Okay. Hi, David. How you
Doc,
doing?
I'm great.
Okay, so David, you're here for your first visit after shocking your Achilles using shockwave therapy 17 days ago.
17 days.
So we just talked a little, and you were very generous in talking to us and trying to help other patients. So we wanted just to give your experience and tell us how you feel today, and also how you did with the treatment and how you felt the day of the treatment.
This treatment is an unknown. It's like nothing anyone's ever had, and you're wondering what it's going to be like. But when it's all said and done, it's the what do you call it? The
Achilles tendonitis.
No,
The numbing.
The numbing. Okay, so it's a little painful, but it's not the end of the world. And when you walk out, there's no pain.
Were you uncomfortable during the treatment?
No.
So you had no pain at all during the
No,
treatment? You were
no.
laying there, and the treatment
No.
took about 18 minutes.
Is that right?
Yeah,
Okay.
18 minutes of full strength, and you went right to full strength.
Okay.
And your history with this, before we spoke a little bit about this.
I've had this for like 5 years.
5 years, and I know you've tried, go through some of the stuff you've had done.
Oh, God. I did physical therapy, I would say twice.
Right,
I did laser actually
right.
a while ago, and then with you just recently. Rest, of course.
Anti-inflammatories, you had a whole sequence.
Yeah.
How long would you say you were on anti-inflammatories for this?
Well, I would say probably three weeks or so.
3
And
weeks?
then you were concerned that
Before you saw me, were you on
Before I saw-
anti-inflammatories?
just by myself.
You were taking over-the-counter stuff?
Advil.
How long were you taking that for, on and off?
I would say a couple of months.
Okay. And you don't remember injuring this, that you said specifically?
No, I played racquetball for 30 years, and
Gotcha.
I do think that I might have caused the problem, to be
Mhm.
honest, because I think I stretched incorrectly, so I would advise anybody, learn how to stretch. I stretched cold.
Yeah, instead of warming up.
And I don't think that was good.
But this was so bad before we fixed it and before we did the shockwave to it. Were you contemplating surgery on this?
No.
So you didn't want any surgery. And then the procedure itself was done 17 days ago. And how have you been feeling since then? How much better would you say you are?
I'm like 50% better. And,
Right.
and like the best way I could say is that if this was the way it was, I probably never would have come to see you. I would have just figured, okay, I'll just take it easy, rest, do home remedies, and just it'll get better eventually.
So it's that much better
It's
just
that much
in
better.
2 weeks.
And even and for me, the test is being able to walk downstairs. Not 100% the way you normally would, but not the other way either, where I had to walk downstairs
Yeah,
sideways.
Sideways. So you're not having any of that now. So
No.
that's much, much better.
The other thing too is like I'd watch TV for an hour, and I'd get up and it would feel all swollen, and it'd be like, oh, this is, I'd be. I'd be moaning and groaning.
Yeah, well, that's no good, and that's one of the
I'm
reasons we
not,
did
no,
this. That's
yeah.
fabulous.
So to sum it up, I mean, I'm glad I did it. I'm looking forward to continuing and getting even better because it's only 17 days.
Right, and we told you that this is a healing process, and it should continue. And the main thing with you, just want to ask you a question about work. How much work did you miss with this?
With the treatment?
Shockwave, yeah.
None.
Yeah, so you basically did it. Did you go to work the next day?
Well, I work out of my home.
So, but you were
I'm
up and
able-
doing.
Yeah, I mean, I work in my home. My office is upstairs, and I'm able to get up and down. And
Right.
it was not debilitating at all.
Great.
I mean, listen. I'm a big talker about health-related things, and especially at a certain age. People give up. They ascribe everything to turning a certain age, and I think that's nonsense because, you don't just give up.
No, our goal is to get you back to activity and really have you have a great outcome.
And I would say, use the Nike approach. Just do it.
That's it.
Just
Good.
do it, Doc.
Wonderful. Well, thanks for talking to us,
Okay.
and we'll see you in a couple of weeks.
All right, great.
Okay.